Today on this episode of The Brain Surgeon's Take, we will be discussing intermittent fasting, pros and cons, with Professor of Nutrition at the University of Illinois, Chicago, Dr. Krista Varady. Learn how intentional periods of fasting alter our physiology with secondary effects on weight, inflammation, and biochemical markers. What are the benefits and possible risks of this dieting routine? Is it for everyone? Much more on this podcast episode. Welcome back, everyone. Here's my take on Dr. Krista Varady. She is a world expert on intermittent fasting. As a professor of nutrition, Krista has dedicated her research towards understanding the physiological effects of intentional and sustained periods of fasting. She lectures all over the world and teaches about this particular dieting regimen, helping educate the public. I loved this interview. For many years, I have practiced intermittent fasting on the weekends and enjoy its benefits. What I found most interesting from my discussion with Dr. Varady were the secondary effects of intermittent fasting, not only on weight loss, but also inflammation, cholesterol levels, and other biochemical markers. Clearly, we are only beginning to understand the mechanisms by which intermittent fasting is beneficial, and it is certainly not for everyone. While intermittent fasting has proven benefits, it may not be suitable or safe for certain individuals. Should you start intermittent fasting? Listen up as we discuss intermittent fasting, pros and cons. Check it out. Hey, Krista, how are you?
Oh, good. Thanks so much for having me on.
Of course. Very excited to have you on the podcast to talk about a trend that is growing in terms of dieting, something that I do myself as well, intermittent fasting. Interested to hear your perspective, not only on the weight loss, but all the potential secondary effects of intermittent fasting on cardiac enzymes, cardiac health, lipids, inflammation. So again, I really appreciate your time and look forward to learning all about it.
Yeah, thanks again.
Let's start with the basics here. What exactly is intermittent fasting and how is it different than starvation?
So, intermittent fasting is actually a really simple concept that involves a period of eating followed by a period of not eating. So, that's really how it's defined. And there's two major types of intermittent fasting where people do kind of a more intense version called alternate day fasting, where you have a 500 calorie fast day alternated by kind of an ad libitum feed day. And then you kind of flip flop the feed and fast day every day. And then there's the more popular version in the US and different parts of the world called time restricted eating, where people eat in a confined window of time each day, usually about 6 to 8 hours. And it's different from starvation in that people are still getting all the nutrients they need. So starvation is defined as like a really intense decrease in energy intake, which usually results in having less protein or not enough protein and not enough vitamins and minerals. So with intermittent fasting, people are really only cutting out maybe 20% of their energy needs. And as long as they're eating a fairly healthy diet, they're still getting all the nutrients.
Tell us a little bit about what happens physiologically when we fast. How does our body compensate?
So this is a little, I honestly think that intermittent fasting is just another way of achieving calorie restriction. So I know a lot of people talk about like metabolic switching and that type of thing where people basically switch from using glucose as their primary energy source to fats. But I honestly don't think that really happens with the types of intermittent fasting I just mentioned. It's just that the fast period's not long enough. So essentially what time restricted eating is doing, what we've seen in our lab and what other labs have shown, is that really you're cutting out about 300 to 500 calories per day by just whittling down your eating window. So observational studies show that we eat usually in a 14-hour window. So with time restricted eating, we're cutting out about 6 hours of eating, whittling it down to 8 hours, and then that just produces a natural reduction in energy. But we're not getting like ketones or anything like that. You really need to do a lot of like you need to do, for most people, like multiple days of water fasting to get full metabolic switching. So really, I think a lot of the benefits of intermittent fasting is really just through calorie restriction and not the fasting itself.
That's great to hear because you definitely read a lot of literature that suggests that there is metabolic switching, but I agree it's too short of a time period
Yeah.
to really have that switch occur. But Let's go over what the scientific literature shows about the benefits of intermittent fasting. So, the first question I think you answered pretty much, but can it help you lose weight? And you're saying yes, simply through calorie restriction.
Yeah, that's right. So I think the main thing it does is help people lose a little bit of weight, but it's kind of on par with all the other dietary restriction regimens like daily calorie counting. People lose anywhere from about 3 to 7% of their body weight. So that translates into like 5 to 30 pounds, depending where the person started out at. So nothing compared, obviously, to like the GLP-1s that we're seeing now, where people are losing like 30% of their body weight or something. So yeah, it's you lose weight for sure with these diets if you follow them.
What does the science show about improving longevity? Is there any evidence to promoting longevity, reducing inflammation?
There's some animal studies in the area with alternate day fasting, the one I was talking about where you have a really intense fast day followed by a feast day. And then in mice models, basically it's shown that it can extend their lifespan by about 20%. The problem is longevity is really hard to measure in humans just because you literally need to follow them their whole lives. And there hasn't been studies that have looked at, that have gone on for 100 years or whatever. So I would say at this point, no, we don't have any solid evidence showing that the way that people actually do intermittent fasting, it improves longevity.
Can intermittent fasting reduce insulin resistance?
Yes. So I'd say besides body weight loss, the other thing it helps out with is glucoregulation. So it can help lower insulin resistance. It helps lower fasting insulin levels. And we see that in people with diabetes and people without diabetes in our studies.
Interesting. How do you think that works? What's the biomechanism behind that?
I just think that there's less food coming in, so there's less insulin being secreted by the pancreas, like really simple. So I think fasting's really unique in the sense that it just gives the body a break. So, in the American culture, we're constantly eating, snacking. If we're not snacking, we're drinking some like sugary coffee drink or something between meals. So with fasting, we just give ourselves a little bit of time and the body can like stop secreting so much insulin to put away all the glucose. And yeah, it's just kind of, I think that's really what's going on.
Makes sense. Uh, can intermittent fasting improve heart health? This is a big one.
It has been shown in some studies to lower LDL cholesterol, triglycerides, and sometimes we've seen some increases in HDL. But in general, we're not seeing a ton of changes. Most studies, I'd say, don't show any changes in blood pressure or plasma lipid levels. But the issue with that is that a lot of people are already on like blood pressure and cholesterol meds when they come into the study. Just yeah, so I think that's the reason most people already have kind of like normal range lipids and blood pressure coming in, so it's hard to see changes when someone's already in the normal range. And it's really hard to find a hypercholesterolemic population to study because their doctors will just immediately put them on cholesterol meds. So
Yeah.
I don't know, I think that question is still we still don't know just yet.
Can intermittent fasting improve metabolic markers?
So other than lipids and insulin and that type of thing, well, with if we talked about like I think you mentioned inflammation, we are seeing some nice decreases in CRP, in C-reactive protein in people that have higher levels at baseline. But we're not seeing changes in any other inflammatory marker consistently, like IL-6 or TNF alpha or anything like that.
Okay, so still very, very preliminary.
Yeah.
What about memory? There's been some discussion that intermittent fasting can produce improved memory. I'm assuming that's through prolonged fasting, ketones, mental clarity, or is there any other data to suggest that fasting will improve memory?
Not what I've seen in humans, and I really just run these studies in clinical trials and in humans. I think there might be some animal literature, but I think the main thing we're realizing now is that the animal literature for intermittent fasting is not translating onto the human literature. I don't think we should use those mouse models because Well, one, the animals are like stuck in a cage. They have no option other than to do the intermittent fasting. So they do it perfectly. Whereas humans, you send them out into the world and who knows what they're doing, but they're definitely not like following exact instructions, as you probably know as a doctor. So, and then also mouse models just basically mice have a really high resting metabolic rate. If you don't feed a mouse in 4 days, it will die. Whereas humans can last for like months on end, depending on their fat stores, right? So it's like a mouse model is like a perfect, a perfect model for intermittent fasting that just wouldn't happen in a human, basically. So I don't know. I'm kind of derailing this a little bit, but I think we're seeing a lot of really amazing changes in animals that get reported in the media. And then people are mad that they're not seeing it in themselves when they do it. But it's just because animals shouldn't be used for this. I think we should just rely on the human data because that's how people actually do intermittent fasting. We're also not seeing ketones increase when we actually measure this in people. So all the things reported for animals are not translating to humans, including the memory effects.
Yeah, that's classic. I mean, in any field of science, I mean, especially when it comes to the brain, the stuff that applies to animals very rarely translates to humans. And so it is a big jump to go from the animal model to a human, and it can be very misleading.
Yeah, exactly. And it's just sorry, just to harp on it a little bit more, I think it kind of gives intermittent fasting a bad rap in the sense that people will read the animal studies and then be mad that, their cholesterol levels aren't going down or whatever they saw in the animals. So, yeah, it's important to just rely on human studies.
Yeah, and just be realistic about it, obviously. What are like, I think you already mentioned, what are the different types of intermittent fasting?
So yeah, there's two major ones that people follow: alternate day fasting, the kind of intense 500 calories one day and then eat whatever you want the next day, and then you just kind of flip-flop like that. And then time restricted eating, where people usually eat but in an 8-hour window, and most people place that window between 12 and 8. And then also to mention that during that 8-hour window, you do not need to count calories. So that's one of the cool things about it. It's a really easy diet to follow because you literally just watch the clock. You kind of wake up, have water, coffee, any kind of like non energy containing beverage. And then at 12, you can start eating. And then all the way up till 8, you don't count calories, just eat, try to eat, focus on a healthy diet. And then by 8 o'clock that night, you stop eating and then you wait until noon the next day.
Should intermittent fasting be done 7 days a week?
Ideally, you're going to get better changes in metabolic markers and weight loss if you are more adherent to the diet. But in our studies, we see people usually do it about 5 or 6 days a week with time restricted eating. Nobody's following these diets on like a Saturday when they're like going out with friends or that type of thing. But yeah, if you can, try to follow it as many days a week as you can.
Is intermittent fasting sustainable in the long term?
So, studies to date, the longest ones have only gone on for a year. So, we know that with alternate day fasting, the kind of harder one where you have to only consume 500 calories every other day, there's people can't do that for a long time. They can do it for like 2 to 3 months, and then we have like dropout rates of like 40% by month 6. And then with time restricted eating, we recently we just published a study, I believe, a year or two ago for 12 months, and we had very low dropout rates, and people were able to do it for a long time. So, and they liked it, and they said they would actually 90% of the subjects said that they would stick to it after. We didn't measure whether or not that was true, though. So,
Can anyone do intermittent fasting, or are there people where it's contraindicated?
I definitely wouldn't recommend it to people over the age of 75. We just don't know. It can result in lean mass loss with any diet therapy. So we don't want to exacerbate any muscle mass loss in that population. And at present, I probably wouldn't recommend it to children and teens until we have a little bit more data. It just might not be safe in those populations.
Makes sense. And I would say that people, of course, before they begin, need to talk to their primary care physician to make sure that they're not going to hurt themselves by doing intermittent fasting. You had mentioned earlier that you don't need to calorie count when you're on those 8 hours of eating, but a question that gets asked a lot is, what is the best way to break a fast and begin eating again at noon? Is it just I mean, you said focus on something healthy, and I totally agree with that. Is there any advice for people when they break the fast, what they should be eating?
There's actually not many studies or any studies that, from what I know, testing out, because I guess people are really worried about like glucose spikes. Because I see this on the internet all the time, people asking. I'd say as long as you're consuming like a mixed meal diet with like enough protein and, try to emphasize whole foods instead of any like heavily processed foods, that would be important. But there's no ideal food to eat to break a fast. I think a lot of this just comes from companies trying to sell products to people for like breaking a fast. But yeah, I think in our studies, we've seen really nice reductions in insulin resistance with people just eating, even whatever they eat. It will still work, but obviously try to emphasize healthier foods if you can.
What about exercise? People ask often, can you combine intermittent fasting with exercise?
Yeah, we've run studies combining alternate day fasting with exercise, and other people have done time restricted eating with exercise. You definitely can. You kind of have to time the exercise according what works for you. So a lot of people like to exercise in the morning, right when they wake up, and they're fasted anyway. That's what we found in our studies. So they didn't really have to manipulate, their exercise schedule. So it is fine, and it tends to actually help maintain lean mass, particularly if people are doing resistance training with intermittent fasting. So with fasting and calorie restriction, generally what you're seeing is about a 25% reduction in lean mass. Like for the weight loss, about a quarter of it is actually muscle mass loss, and then 75% of that is fat mass loss. So if you want to, and that happens for every diet, it's not unique to fasting. So if you want to kind of keep more muscle mass, it's important to do like weightlifting and resistance training. So there's been studies showing that you can actually basically not lose any muscle mass loss if you're combining fasting with weightlifting.
Great to hear, because it is tough when you're working out. If you work out in the morning and you don't eat till noon, there is that period of hunger. Speaking of which, what is the best way to manage that hunger that occurs potentially when you get up? You haven't eaten since 8 p.m. You get up at anywhere between 6 and 8 a.m. You got those 6 to 4 hours where you can't eat. Is there a recommendation for ways to manage that hunger while you're waiting for noon?
Yeah, in general, there's like some tricks where people like to chew like sugar-free gum, or consuming hot beverages tends to help people. So like tea or coffee without any additives. But people we do appetite. We look at people's appetite and how that changes over the course of the study. And I'd say the first 2 weeks are going to be tough. Like I'm not going to lie, it's a bit of, you kind of have to ramp yourself into it. But after a while, people aren't hungry in the morning anymore, and they can kind of sustain themselves off those warm beverages until noon, and then kind of have that and then feel okay. But there's not, I would definitely recommend having more of a higher protein diet during the eating period, and that has helped people also be less hungry during the fasting period.
Makes sense. Yeah, definitely having a dinner that's high in protein is gonna
Hmm.
last longer than just a bowl of pasta. The next morning, you're gonna
Yeah,
be
yeah, exactly.
starving with that bowl of pasta. I can tell you that right now. Are there any side effects potentially to intermittent fasting? We've talked about all the positives, but are there any negatives or side effects to intermittent fasting?
So we like measure adverse events in all of our studies, and we find the main one is people get headaches in the first 2 weeks because they're not drinking enough water. They're dehydration induced headaches. That's the main side effect we see. But in general, both diets, alternate day fasting and time restricted eating, are safe. We've even tested this now in type 1 diabetes and type 2 diabetes, and we're not seeing elevated risks of hypoglycemia in those populations, provided that people work with their doctors and adjust their meds, obviously. So in general, it's safe, and there's nothing major, no.
Yeah, I mean, I would say that some people have trouble dealing with the hunger, but other than that, I don't think there'll be any long-term side effects. Uh, what is the best way to get started on a fasting diet? Someone listens to this podcast or they read about it and they hear about your work. What do you recommend if they're like, I want to get started on an intermittent fasting diet? Is there a way to ease into it?
I would definitely recommend starting with like the easier one of the two, time restricted eating. People generally are able to do that one a little, they just find it a little easier. The thing with time restricted eating is that the weight loss isn't as intense as what you see with alternate day fasting. So people lose about twice the amount of weight when they're doing alternate day fasting, the kind of 500 calorie every other day. So I wouldn't recommend jumping right on the harder one. Maybe just start with the easier one and then transition to alternate day fasting if you want to ramp up your weight loss.
And then final question, because I know you're busy and you got a hard stop coming up, but give us your crystal ball view. What advancements do you see in diet and human physiology forthcoming in the next 10 years based off the work you're doing and all the frontiers that we're learning about?
I think we really need longer, more well-powered, larger studies in intermittent fasting, like clinical trials. Right now, I think the biggest, we have like 100 people or something in a study for a year. But if we could get like a multi-center study looking at, can people stick to this for multiple years? What are the metabolic improvements that happen? That would be really important. Might be difficult with all the NIH funding stuff that's going on right now, but we'll see what happens. And then, yeah, I'd say that's the main thing. And then just seeing if people can stick to it. And then also maybe if they could combine this with the GLP-1 drugs. I think that would be really interesting for people to use those GLP-1s to lose weight initially. And then maybe if their insurance company won't pay for it after they've maintained a normal weight, maybe they could use intermittent fasting to sustain that weight loss as kind of a maintenance approach. I think those would be kind of interesting areas to study.
What a great interview, Krista. I want to thank you for your time. I think you really hit the nail on the head when you were talking about that in this country we just eat and eat and eat and like 24 hours a day, 7 days a week, you are consuming some form of calories, whether it's a soda, a juice, food. It's like
Mhm.
you're right, your body's just getting overloaded with constant consumption of calories. And I think the main point, as someone who does this intermittent fasting routine, I think like you said, it just gives your body a break.
Yeah.
Like we've got this time period, 16 hours where it's just water and coffee with no calories, and your body just gets to reboot. And I think that there's a lot to be said for that. And in the society we live, eating is obviously a problem because people don't eat to live. They just eat just to eat. They're bored, there's food next to them. And I think it not only puts on weight, which is obviously a huge problem with obesity and inflammation and cancer, but it just all like the metabolic markers that we talked about and the energy levels and longevity, I think all gets affected by overeating.
Oh, absolutely. It's tricky for people though, because like we live in such an obesogenic environment where, these companies have like food engineered this like perfect combination of like sugar, fat, and salt to make us like eat the whole bag of chips opposed to like putting it down after the serving size is complete, which never happens.
Hmm.
So it's tricky. I honestly, I know I'm like a nutrition scientist and I study dietary interventions, but I do hope the GLP-1s really help with that, with lowering appetite and getting people's appetite hormones back into check and just, because it's all cyclical with like having too much visceral fat and inflammation. And so anyway, I really hope those help out and hopefully diet interventions can kind of be a combination therapy with those.
Totally agree. Krista, thank you for your time, and really most importantly, thank you for all your work in this field. Very impressive what you and your lab and your group have done, and continue making great progress. Thanks so much again.
Oh, great. Thanks so much.
Have a great weekend.
All right. Bye.